Today we're going to show you how to operate an automated external defibrillator, or better known as an AED. Once the AED arrives, place it at the victim's side next to the rescuer who will operate it. If there are multiple rescuers present, one rescuer should continue chest compressions while the other rescuer operates the AED. To begin, the rescuer should power on the AED. It will then prompt you through the rest of the steps you need to follow.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Analyzing heart rhythm.
Stand clear.
Do not touch the patient. Shock advised. Charge.
Clear.
Stay clear of patient. Deliver shock now. Shock delivered. Paused. Begin CPR.
While administering chest compressions, under the following circumstances is CPR only allowed to cease: when a higher level of care provider relieves you, the patient resumes their natural breathing patterns, or the rescuer undergoes physical fatigue. Now, there are a few special scenarios which may cause problems using the AED. First, if the patient has a hairy chest, you must use a set of either pediatric pads or an extra set of pads in order to remove the chest hair before reapplying the pads onto the patient. So you'll secure the pads and then quickly remove them in order to remove the hair. Next, if your patient has water on him or her, it is appropriate for you to wipe off the water from the chest. Furthermore, if you find a patient lying in a puddle, make sure that you remove your patient out of that water resource. Next, if there's a set of implanted defibrillators or pacemakers, you must make sure that you shall immediately identify these devices because they create a hard lump beneath the skin of the upper chest or abdomen. The lump is a half-size deck of cards with an overlying scar. If you place the AED pad directly over an implanted medical device, the device may block delivery of the shock to the heart. And lastly, for transdermal medication patches, you should not place the AED pads directly on top of a medication patch. You must also make sure that you are wearing gloves when removing this patch, and it won't delay shock delivery, so remove the patch and wipe the area clean before attaching the AED pad.